It's a pleasure to be here, and thanks a lot for the invitation. Indeed, my name is Costongs, and I know that all of you know me, but I'm around for a long time, because when we talked about Godes Plus and Godes, I still even remember Godes, the project before that, and before that I've been too long in the field. But it is so exciting, no? Working on health promotion and how can we improve health of everyone in Europe with others. It's such an important task and such a complicated task as well. And I'm still figuring out what is the magic bullet and how we can do that best. And that's why I'm still in the business. So EuroHealthNet, we, as you may know, we are a partnership of national public health institutes, some regional health authorities and ministries of health. That's the core partnership. And in that sense, you can see it as a sustainable partnership, because we have been able to sustain the same partners for over almost 30 years now. And all of the lessons learned from the different projects are embedded in that sustainability. We have 3 areas in which we work: policy. So we monitor European Union policies to see how effective they are to reduce health inequalities, and we try to give input. We are participating in some research projects in order to work in an evidence-based way as much as we can. And in the practice, we focus very much on transferability and looking, okay, what works at the local level, and how can we make sure that it is scaled up. So we have been working with Godes Plus, indeed, Equity Action, which was the joint action before JAHI, which is the joint action on health inequalities that was coordinated by ISS and which we supported. But also the joint action best remap is on nutrition and food. And the Joint Action Prevent NCDs, we are affiliated. But here I wanted to share with you some of our insights from 2 projects. One is Eyes Heart, and the other one is on Schools for Health. The Schools for Health activity, it's also funded by the EU for Health Work Programme, is really about making every school a health promoting school. We are linked with the SHE network, with the Schools for Health network, which is an existing network set up by the WHO in order to make it as sustainable as possible. And we have several partners as part of this project. We are building our work on the lessons from Godes Plus. One lesson is that it is important to invest in a strong implementation team with committed leadership. If you don't have the principals of the schools or the teachers on board, it's not working. But the second lesson from Godes Plus is that it is important to invest in the links between the owners of the good practice that you are transferring and the implementers. That is important, to have the communication up and to also work on an agreement at the start of the project to manage expectations of what of the components of the good practice is still valid and works and will be taken forward in the implementing country. And above all, to make it fun, as it is important to do this and enjoyable and work in communities of good practice. That's also an important recommendation from Godes Plus. This is a model from Godes Plus developed by Maastricht University. It's the PhD process model that really puts in all the important questions that you need to ask yourself in terms of the factors that may inhibit or enable implementation. And it's describing the settings approach, which is a bit what Rosanna was referring to, and put all the factors out there, so you may want to look into that model. What we found in very briefly on Schools for Health, administration, that is a lot when you participate in EU projects that you are all familiar with. For example, the Regional Ministry of Health in Andalusia, they said that about 80% of the work that they do is administrative. I must say that it is also related to the fact that we work on procuring fruit for schools, and that comes with a lot of administration. Another issue is that this happens in Hungary, for example, that some officials may not be comfortable to say what goes bad or what's not good. Like this teacher said, okay, they didn't really know what can be done to make schools more health promoting. And in the Schools for Health project, indeed, it is not easy to involve schools in deprived communities and with children with deprived backgrounds in pilots. And I think we may even wonder ourselves how ethical it is to involve schools in deprived areas and students with deprived backgrounds in pilot projects, because we don't want to overpromise and then not live up to the expectations if you're not able to make it sustainable. So I think there's an ethical component here that we may need to discuss in the panel. Ice Hearts Europe is a second project in which we participate, and it's a very nice good practice. It's on engaging children that are vulnerable or live in difficult circumstances, to engage them in the team sports, in ice hockey in this case, and to link them with a mentor, a social worker, during 12 years. And the mentor supports the children at school, after school, and at home. And we are, it's from Finland, and we are looking how this can be transferred to different countries, 5 different countries: Spain, Italy, Slovenia, Denmark, and Estonia. And also here there are some. First this one, of course. But this is what you all know, and you are doing that as well in your work. You first set out the situation analysis and needs assessment, in particular to see what is the gap that you want to address between the existing situation and what is desired. And what we found is that, of course, you can't transfer just like that. Ice hockey obviously is not a sport done in Spain or Italy. But we also found that it is not so easy to access schools, but also access to sport facilities are different in different countries. And even in Italy, there's differences in regions, how sport clubs and sport associations are organized, and the different legal situations also, who owns a sport facility. Also, the legal situation in terms of hiring and appointing people that work with children is very different between countries, and a finding that resonates very much with some of your findings also, that it was better to embed the good practice in existing initiatives, existing policies, and existing frameworks, rather than competing and coming up with something new. I think that is a really very important element here. If we talk about inequalities and social determinants, often the good practices that we discuss are too much tackling with what you see, which is the top of the iceberg, rather than what we know is the rest of the iceberg, which is under the water. And these are the daily living conditions, like how people live, education, employment, working conditions, and so on, which are the social determinants, but even the layer below, which are the structural determinants of health. So the inequalities in power, inequalities in wealth, fiscal policy, gender, racism, poverty. We need to address poverty, which is the structural determinant of health, because any other health project, is a bit making it help here and there, but it is the poverty that's the root cause. And how DG Santé works, obviously, with their best practice portal, with a lot of the best practices, may be more superficial projects where we are not able to alleviate the poor conditions people live in, which is understandable, because it's not easy to deal with poverty. But I do think that we need to have this iceberg in mind in all that we do. The iceberg actually comes from Fran Baum, Professor Fran Baum, and she will also be speaking at the plenary session on Thursday when we discuss health inequalities in times of crisis. But I like the iceberg very much as a way to remind us that we need to take this health equity lens as a cross-cutting issue in all of the work that we do, not only at the high policy level, but also very practically. If you want to engage parents, make sure that there is childcare for them. If you make sure that there is public transport, that they can pay the bill, that they have time, that they are not busy in their day-to-day jobs. They do need to do that in order to get the money, but that they have then the time to engage. The second recommendation, indeed, it was mentioned by Paulo that in the Godes Plus, the policy dialogues are a really important element for transferability. So engaged policymakers, make them aware of the good practice, not only at the local and national level, but also look at the EU level. There are frameworks that you can use to make the case why it is needed to implement the practice, like the strategy of the rights of the child, European Child Guarantee, and so on. There's a new European Union anti-poverty plan that's going to be designed, which will also be interesting to look into. Then my third point is evaluation. We need to make sure there is enough time that we can invest in evaluation and how things impact on health equity, because we have to demonstrate what works. We have to demonstrate that it is important and the money is invested in the good practice in order to make sure we can continue to get the financial support for the sustainability of our work. And lastly, indeed, what we are doing here is linking up all of the communities at the local, regional, national, international level. So, for example, in the joint action Prevent NCDs, the idea to set up a consortium on prevention and promotion. It's framed in cancer at the moment, but I think that will be broadened up. That is another sustainable mechanism for our communities to link up, to get together, and to continue working together, which is key. And that was it. Thank you.